And with rural healthcare under the spotlight, she's going to shed some light on working in a small country hospital. Sophia Zohrab is on Auckland University's Rural Medicine Immersion program, which exposes students to the opportunities and challenges of working in rural healthcare. She grew up in some of New Zealand's remote and rural places herself, and now she's based at Hawera Hospital for the year. It has an emergency department and GP practice, maternity care, rehab wards and mental health and addiction facilities.
So I sort of put my hand up in my second year of medical school. Dr. Carl Eagleton, who's sort of overseeing our program, was trying to find people who are interested in rural healthcare. So about 12 of us put our hands up, and we've had so much sort of teaching and extra experiences on it. And I think growing up in those rural environments, and also they've always sold it as being, a bit more hands-on, which definitely appeals to me. I quite like those new experiences and getting to do those extra things.
Those expectations, have they been met? Is it like that?
Yeah, it really is. I couldn't be happier with how it's going. Even in our second year, where you're really only in the classroom and you shouldn't really be stepping foot in the hospital at all. Even then, we, as second years, were invited to go out to like an emergency department to do sort of 24 or 48 hours. We get better relationships with the senior doctors. We get to be more one-on-one. We definitely get to be, more hands-on, because you're just not competing with so many other people who are a bit further on in their training. So even as, say, like a fifth or a fourth year, and then you have to compete with the senior students, the junior doctors, the registrars, all of them wanting to do things. And in somewhere like Hawera, it's really just you and the senior doctor. So you get more experience.
And I guess you see a lot more variety.
Yeah, absolutely. I do get a lot more experience, but being in this sort of rural hospital, a lot of the more complicated, say, psychiatric or pediatric presentations will generally go to more specialist care, which just isn't really done in the smaller region like Hawera. So while you might get a bit more of the bread and butter, you don't get so much of that really niche specialty stuff.
What kind of relationships can you build with the patients and the local community? Do you think it's easier or more tricky than in an urban setting?
I would say it's definitely a lot easier. It's not really a thing as a student that you get to do in the urban setting. I mean, you might have, say, a couple of weeks in a GP practice, but within 2 weeks, most people don't go to see their GP more than once. And then in the hospitals, they're just so big that you don't really get the opportunity to see those same patients again. They're such big places. Whereas in Hawera, there's only like 10,000 people living there, and we are there for the entire year. So within your placement in your general practice, you can see those patients multiple times, which is really quite unusual as a student to get that sort of longitudinal experience. And even then in town, you run into them as well, which brings its own unique challenges. Everyone knowing who you are in a small town and a even smaller hospital is interesting. Certainly in the bigger hospitals, if you want to sneak away earlier on a Friday afternoon to have a beer with a friend or something, is something you can get away with in the big hospitals, not so much in the small areas. And then, running into patients that you know, and I think I went into a Repco type store, and 3 people I had treated came up and said hi while I was in there, and so you have to sort of have your patient-student confidentiality and making sure you're not breaching that and you're acting appropriately. It's just something that wouldn't ever crop up in, say, Auckland.
And I guess it's quite nice in a way as well.
Yeah, it is. It is. Yeah. I know there is the potential for that to potentially become an issue, especially when you are a doctor and then can prescribe, and maybe someone comes up to you in the middle of town and says, "Hey, can you have a look at this and maybe give me something for it?" Right? But as a student, we're sort of protected from that because the patients understand that we don't really have the ability to, say, dispense medications and so on.
And on a personal level, how have you found it living rurally? Especially with long hours you must be working?
Yeah, I mean, we do have pretty long hours, but on the whole, I've really enjoyed it. So there's three of us, obviously. So the other two students and I, we all live together, and we get along really well. And everyone at the hospital has been so lovely. The senior doctor staff are, like, obviously they're our teachers and our mentors, but we also feel like our friends, really. And we've been invited to plenty of things. The community's always reaching out to us. I started playing squash at the local club, and I've got a friend I've met through there. We play every week. We go to a pub quiz every week with some of the hospital staff. And we've also had Taranaki Foundation, which is like a charitable group. They rented a house for us to stay in and have been so supportive and are always getting in touch with different opportunities and so on.
Sounds like a very warm and welcoming community that you're in. Getting back to some of the more sort of clinical side of things, how do you think working in a rural setting is shaping your clinical skills or approach to medicine?
It is different to the city. There is a far more generalist approach, which in terms of a future career, I see it as a bit daunting because the amount of knowledge that you're expected to have and be able to treat is quite different compared to your, say, urban counterparts.
Has this experience influenced your thinking about where you'd like to work once you graduate?
Yeah, it has. And even though I sort of talked about how daunting it would be to be that sort of rural hospital doctor, I think it is kind of what I want to do. And I know there's a rural hospital training program where you're sort of dual trained as an emergency physician and also as a general practitioner. You can sort of do a bit of both, and that quite appeals to me, keeping that really, really broad skill set. I've always thought it's such a shame to go all the way through medicine and learn all of these things and then end up just specialising in, that one niche area. I quite like the idea of maybe it not going so deep, but keeping a really broad skill set.
Sophia Zohrab, a fifth-year medical student on Auckland University's Rural Medical Immersion program.